What is Graves' disease? Graves' disease is an autoimmune disorder that affects the thyroid gland, a small gland located in the neck that produces hormones that regulate metabolism. In Graves' disease, the immune system produces antibodies that stimulate the thyroid gland to produce too much thyroid hormone, a condition called hyperthyroidism. It was named after the man who first described it in the early 19th century, Sir Robert Graves. Risk factors and causes of Graves' disease. The exact cause of Graves' disease is unknown, but it is believed to be a combination of genetic and environmental factors. Some of the known risk factors and potential causes of Graves' disease include family history. Having a family member with Graves' disease or other autoimmune disorders increases your risk of developing the condition. Gender and age. Graves' disease is more common in women than men, and it often develops between the ages of 20 and 50. Autoimmune disorders. If you have other autoimmune disorders such as type 1 diabetes or rheumatoid arthritis, you are at a higher risk of developing Graves' disease. Stress. Severe emotional or physical stress can trigger the onset of Graves' disease in some people. Smoking. Smoking has been linked to the development and worsening of Graves' disease. Pregnancy. Pregnancy can trigger the onset of Graves' disease in some women, particularly in the first year after giving birth. Infection. Certain viral or bacterial infections have been associated with the development of Graves' disease. Overall, the exact causes of Graves' disease remain unclear, but researchers continue to study the condition in order to better understand its origins and potential triggers. Symptoms of Graves' disease. Graves' disease is an autoimmune disorder that affects the thyroid gland, leading to overproduction of thyroid hormone, a condition called hyperthyroidism. The symptoms of Graves' disease can vary widely from person to person, but some common signs and symptoms include anxiety and irritability, restlessness, tremors, weight loss despite increased appetite, fatigue and weakness, insomnia or difficulty sleeping, rapid or irregular heartbeat, heat intolerance and excessive sweating, increased sensitivity to light, changes in menstrual patterns, difficulty concentrating and remembering things, muscle weakness and or muscle wasting, frequent bowel movements, diarrhea, changes in vision, such as bulging or protruding eyes, eye redness, double vision, and discomfort, and swelling of the thyroid gland, resulting in visible lump on the neck. Not all people with Graves' disease will experience all of these symptoms, and some people may have no symptoms at all. If you are experiencing any of these symptoms, you should consult with your doctor to determine if further evaluation and testing are needed. Complications of Graves' disease. Graves' disease, if left untreated or poorly managed, can lead to a range of complications. Some of the possible complications of Graves' disease include thyroid storm. This is a rare but life-threatening complication that can occur if the thyroid gland produces a large amount of thyroid hormone, causing severe symptoms such as fever, rapid heartbeat, high blood pressure, and confusion. Eye problems. Graves' disease can cause eye problems, such as bulging eyes, double vision, eye pain, and vision loss. In severe cases, eye problems can lead to blindness. Skin problems. Some people with Graves' disease may develop a skin condition called pretibial myxedema, which causes thick, red, and scaly skin on the lower legs and feet. Osteoporosis. Overproduction of thyroid hormone can lead to bone loss, increasing the risk of osteoporosis and fractures. Heart problems. Graves' disease can cause heart problems, such as an irregular heartbeat, high blood pressure, and heart failure. Pregnancy complications. Graves' disease can increase the risk of complications during pregnancy, such as preterm birth, low birth weight, and preeclampsia. Mental health problems. Graves' disease can cause or worsen anxiety, depression, and other mental health issues. It is important to work closely with a health professional to manage Graves' disease and prevent complications. Graves' disease diagnosis. Graves' disease is typically diagnosed by a healthcare provider or an endocrinologist, a doctor who specializes in hormone-related conditions. The diagnosis may involve several steps, including medical history and physical exam. The healthcare provider will ask about symptoms, medical history, and family history of autoimmune disorders. They will also perform a physical exam, including a check of the thyroid gland for swelling or lumps. Blood tests. Blood tests can measure thyroid hormone levels, thyroid-stimulating hormone, TSH, levels, and the presence of antibodies that are specific to Graves' disease. Radioactive iodine uptake test. This test involves taking a small amount of radioactive iodine, which is absorbed by the thyroid gland. A special camera is used to measure how much iodine the thyroid gland absorbs. Thyroid ultrasound. This test uses sound waves to create images of the thyroid gland, allowing the healthcare provider to check for abnormalities or nodules. Fine needle aspiration biopsy. If a nodule is found on the thyroid gland, a small sample of tissue may be removed with a thin needle and examined under a microscope to check for cancer or other abnormalities. It is important to note that not all of these tests may be necessary for every person with suspected Graves' disease. The healthcare provider will determine which tests are needed based on the individual's symptoms and medical history. Graves' disease treatment. Graves' disease is a treatable condition, and the treatment plan will depend on the severity of symptoms, the individual's age, overall health, and personal preferences. Treatment options for Graves' disease may include antithyroid medications. These medications, such as methimazole or propylthiouracil, work by blocking the production of thyroid hormone. They are typically taken for several months to a year, and the dose may be adjusted based on thyroid hormone levels. Radioactive iodine therapy. This involves taking a small amount of radioactive iodine in a pill form, which is absorbed by the thyroid gland and destroys the overactive thyroid cells. This treatment is often effective in reducing thyroid hormone levels, but it can also lead to an underactive thyroid gland, requiring lifelong thyroid hormone replacement therapy. Surgery. In some cases, surgery may be recommended to remove part or all of the thyroid gland. This option may be considered if antithyroid medications or radioactive iodine therapy are not effective, or if there is a concern about thyroid nodules or cancer. Beta blockers. These medications can help relieve some of the symptoms of Graves' disease, such as rapid heartbeat, tremors, and anxiety. Eye drops or surgery. If Graves' disease is causing eye problems, medications or surgery may be recommended to reduce inflammation, relieve eye pressure, or improve eye alignment. Regular monitoring of thyroid hormone levels and thyroid function is necessary to ensure that treatment is effective.